Why is it that when we as sportsmen come across wildlife that has died either naturally or from disease, caught in a fence, from a fight with another animal, or hit by a car, our first reaction is, what a waste? Hi, I'm Shane Mahoney. If you've been able to watch Boone and Crockett Country in the past, you probably have noticed that this is not your typical hunting show. The Boone and Crockett Club and our conservation partners who help bring you this show each week believe strongly that sportsmen should be knowledgeable on all the issues. Of course, how and where to hunt are important and make for entertaining television, but this is not the knowledge I am referring to. Today, we will be discussing wildlife diseases and wildlife health. This may not sound like an entertaining topic, but to those of you who have come across a game animal in your favorite hunting area, dead or dying from some mysterious cause, I assure you this episode will be informative. We care about the game we hunt, and for certain the food, wild or domestic, that we bring home to feed our families. As hunter conservationists, we subscribe to wise use without waste. Our wildlife dying from diseases that could be prevented, or at least minimalized, is waste. What should concern us all, and what we should be striving for, healthy wildlife, is next on Boone and Crockett Country.
Boone and Crockett Country, presented by Leupold, America's Optics Authority.
Heading into the 2012 season, there was a buck on our farm that I was really excited about hunting. It was a deer that we had nicknamed Bubba. And if you've been a regular viewer of the MidwestWhitetail.com web shows, you know the history that I've had with this deer, dating all the way back to 2008. So I figured maybe this year, 2012, was going to be the year that I finally had my second crack at Bubba. I put the trail cameras out in early September and was excited to see that he was a regular visitor. Almost every evening, Bubba was showing up in front of the cameras. Then all of a sudden, about mid-September, he just fell off the map. Finally, in early November, I decided it was time to walk the farm to see if Bubba was a casualty of VHD. This disease had hit our area hard, and most of the deer would die in the late summer, about the same time that Bubba dropped off the map. So I grabbed my camera and headed out onto the farm to walk a few ditches and creeks.
As sportsmen, we care about wildlife, and not just those species we are legally permitted to hunt. As hard as it can be to explain to those who do not hunt, seeing wildlife suffer or die needlessly is more disturbing for us than returning from a hunt empty-handed. Many things threaten the health of wild animal populations, including environmental toxins, climate events, habitat alterations, the introduction of exotic species into native populations, and disease, just to name a few. From a historical and scientific perspective, what we know about wildlife diseases is still relatively new. Our first concerns were simply based on direct field observations. If a lot of animals were found dead without obvious cause from accident or predation, it was just assumed that a disease of some sort was involved, but no one knew exactly what or how it might have occurred or been transmitted. Thus, for early wildlife declines, we can only conjecture about potential disease involvement. Certainly, intriguing questions remain over reports of large numbers of animals found dead without gunshot wounds or arrows. And certainly, we can today appreciate the effect disease can have when we look at the well-studied problems of disease transfer from domestic sheep to our wild sheep populations and the devastating results that emerge. Of course, our mountain sheep never occurred in the vast numbers bison did. However, the introduction of domestic sheep certainly resulted in the introduction of new diseases, which our native mountain sheep had no immunity to. These diseases were catastrophic, and entire populations of wild sheep collapsed. The wildlife disease issues that are getting the most attention from sportsmen and other wildlife enthusiasts, as well as from private and public landowners today, are those that are killing our deer, elk, and antelope.
Wildlife diseases are nothing new, and in a very real sense are part of the natural system, caused by naturally occurring organisms, bacteria, viruses, and the newly discovered protein structures known as prions that have existed for as long and longer than many of the wildlife species we are most familiar with. So in this sense, wildlife diseases must be accepted as a fact of life.
The good news is that over time we have built up the resources and science to help address wildlife health issues. Today, human and financial resources from the federal government, state wildlife agencies, private laboratories, and conservation organizations are being committed, and wildlife disease is considered a priority and critical challenge.
The Boone and Crockett Club has had a committee dealing with wildlife health issues since 1911. Back then it was called the Game Preservation Committee. Since that time, other conservation organizations have joined us, as has the federal government and some state agencies.
The Center for Disease Control and Prevention, CDC, was established in 1946. It works to protect and promote public health and safety by providing information to enhance health decisions.
In today's globalized society, animals and animal products can be transported intentionally or inadvertently across the world in a matter of hours or days, making the spread of diseases a very real threat. Diseases can directly or indirectly impact wildlife populations as well as humans and domestic animals. An excellent example is 2003 introduction of monkeypox into the United States via African rodents imported for pets.
The issue of wildlife health and diseases that sportsmen are or should be most familiar with today are CWD, chronic wasting disease, EHD, epizootic hemorrhagic disease, and Hydatid disease.
In 2002, the Rocky Mountain Elk Foundation and the Mule Deer Foundation joined with Boone and Crockett to form the CWD Alliance. The purpose of the alliance was to bring facts and science to discussions about how to address the outbreak of CWD, which is a deadly disease that affects both deer and elk populations and has been found at an accelerated rate over the last 15 years.
Chronic wasting disease is a degenerative brain disease that affects elk, mule deer, and whitetail deer. It is possible the disease first emerged in mule deer as far back as the 1960s. The origin of CWD is not known, and it may never be possible to definitively determine how or when CWD established itself. The disease is transmitted by direct animal-to-animal contact through saliva, feces, and urine, and indirectly via environmental contamination. CWD is fatal in deer and elk, but there is no evidence that CWD can be transmitted to humans, according to the CDC and the World Health Organization. No vaccine or treatment is available for animals infected with CWD, and once identified in a population, culling or complete depopulation has provided only marginal results. What we can do is to try to minimize the spread of the disease when transporting captive wildlife.
What we have seen is the spread of CWD via live animal movement between captive deer and elk in breeding facilities and shooting enclosures, and between these captive animals and wild populations. To reduce the risk to wild populations, several states are now fighting efforts to expand deer breeding operations in their states.
Documented cases of CWD have been found in 16 states and 2 Canadian provinces. In most, but not all cases, where the disease has been found in wild populations, it is also present in captive populations within these regions. A strong linkage between captive rearing of elk and deer and the emergence of CWD in wild populations has been established.
In most cases, of course, animals which die of disease are never recovered or observed by people, and this part of the ecology of wildlife is therefore often poorly known, and we are constantly trying to play catch-up in terms of our understanding of how, why, and to what extent these diseases occur. This knowledge deficit is most concerning where such diseases have been proven, or are suspected to be, transmissible to humans. In this regard also, the inescapable truth is that a direct relationship exists between the captive raising of wildlife, deer species in particular, and the emergence of certain diseases in wild populations. And this ought to be of enormous concern to us as hunters. The captive breeding and genetic manipulation of wildlife is reaching bizarre proportions and is of great concern to me personally and to most hunters. But when we can reasonably connect this Frankendeer problem with the same captive wildlife industry that has a clear connection to wildlife disease, I believe our concerns should increase dramatically. I think every hunter and every hunter-based organization, as well as every citizen who is concerned for the fate of wildlife, ought to be concerned and engaged on this issue. While the first step in this process is to become aware that the problem exists, we need to demand clear and factual answers to our questions of the captive game industry and governments both. The distortion of wildlife's natural beauty in pursuit of profit and the potential for wildlife disease transmission to humans are not issues to be ignored.
And was excited to see that he was a regular visitor. Almost every evening, Bubba was showing up in front of the cameras. Then all of a sudden, about mid-September, he just fell off the map. In early November, I decided it was time to walk the farm to see if Bubba was a casualty of EHD. So I grabbed my camera and headed out onto the farm to walk a few ditches and creeks. Here's a small buck. Certainly not Bubba, but nonetheless, another dead buck off our property. Dang it. That's what I was hoping not to find, but what I was afraid. He just disappeared completely off the cameras. So I thought either he left or he died from EHD, and I guess I was hoping that he'd left, then would he come back, but he's been dead here for a long time. I'd say he's been dead here since about that time. At least I found him. We closed the chapter on another one of these old monarchs.
Epizootic hemorrhagic disease, or EHD, is an acute, infectious, often fatal viral disease of some wild ruminants, especially white-tailed deer. Transmission of the disease is from a biting fly or midge. All documented outbreaks of EHD have occurred during late summer and early fall, and have ceased abruptly with the onset of the first insect-killing frost.
Hemorrhagic disease, which is caused by blue tongue and EHD viruses, is the most important viral disease of white-tailed deer. In some areas, high mortality rates can have a significant effect upon deer populations, reducing deer numbers. New epidemiological features, including detection of viruses not previously found in the U.S., and the northward expansion of hemorrhagic disease tells us that things are changing and we need to pay close attention because of the potential population impacts. There's no known effective treatment or control for hemorrhagic disease.
To this point, we have discussed wildlife diseases that do not transmit from wildlife to humans. There is one disease, however, that can be carried by wolves, coyotes, and dogs that can transfer to humans. It is one that few people are talking about. Hydatid disease is a potentially fatal parasitic disease caused by a tapeworm and is transmissible by wolves and dogs to sheep, cattle, ungulates such as deer and elk, and even to humans. Though most common in areas where domestic livestock, dogs, and humans interact, such as in sheep herding operations, the disease becomes a wildlife issue where populations of wolves, coyotes, deer, and elk, and domestic dogs overlap, which is an increasingly common scenario in states where wolf populations are on the rise.
For some people, we will never have enough wolves, regardless of their impacts to deer, elk, moose, or livestock. This isn't the frontier anymore. Wildlife must now be managed on a human-dominated landscape. We are learning about the impacts wolves can have on their prey, but the potential disease impacts to humans and domestic pets from more wolves living closer to man are yet to be seen.
The eggs of the tapeworm that cause Hydatid disease are spread through the feces of wolves, coyotes, and foxes, and are ingested by grazing deer, elk, and moose. Wolves and coyotes represent the reservoirs of Hydatid disease. By moving to lower elevations, infected deer or elk can in turn deposit Hydatid cysts in areas where domestic dogs may become infected. The parasite may then be transferred to people through contact with their infected pets.
And now, a closer look with Doug Painter, presented by Leupold, America's Optics Authority.
It should come as no surprise that without wildlife sciences, there would be no such thing as wildlife health. Wildlife and the ecosystems they inhabit, plus the X factor, man, are simply too interconnected and complex not to have the best science on hand. Plus, the environment and the natural and unnatural stresses placed on the environment are constantly changing. The need for a top-level animal testing facility became an imperative because of diseases such as bovine tuberculosis, West Nile virus, and research into avian flu that continue to make animal and food safety issues a critical national concern. Now we have such a science facility. In response to an unprecedented number of cattle deaths on farms throughout the state in 1973 and 1974, Michigan established a new premier veterinary diagnostic center for population and wildlife health at Michigan State University in Lansing. The MSU Diagnostic Center for Population and Animal Health has quickly become an invaluable state-of-the-art resource facility, offering quality, trusted, and comprehensive veterinary diagnostics. Faculty and staff are currently working with national, state, and local officials to research and counter threats like avian influenza, bovine tuberculosis, West Nile virus, and chronic wasting disease. Animal health should be a concern to everyone, from sportsmen who care about diseases that affect game populations to everyone who goes to the store to buy food for their family. The good news is we now have the science to identify, track, and address emerging animal and public health issues. For more information on wildlife health, visit the Boone and Crockett website.
Boone and Crockett Country has been brought to you by Leupold, America's Optics Authority, and the Boone and Crockett Club, celebrating 125 years of conservation and North America's hunting heritage.
My family's been making knives for sportsmen for over 100 years. Like many, I knew about the Boone and Crockett Club scoring and record books. I didn't know how much this organization did to actually establish the system of North American conservation until I became a member. I've learned the opportunity and the abundance of game we have today didn't happen by chance. It took purpose, and Boone and Crockett was responsible for most of it. If you're a fan of wild places and the wildlife living there, I urge you to join the first hunter conservationist organization in North America.